thanks so much for joining our webinar today, the Security Risk Assessment Requirement and Resource. Where Hybrid Solutions is Georgia's Health IT Center, assisting clinicians across the state of Georgia to promote interoperability through successful use of EHR technology. We partner with various healthcare systems across the state of Georgia, DCH, GHIN, and many other community and professional partnerships. We are located at Morehouse School of Medicine, National Center for Primary Care. Our executive director is Carmen Hughes, and executive medical director is Dr. Dominic Mack. I will go ahead and turn it over to our program manager here at Hybrid Solutions, Selena Williams. Take it away.
Good morning, everyone. Thank you so much, Brianna. I'm going to introduce our presenters today. We have Kelly Jolley, founder and founding member of Jolley Law Group, LLC, and author. She's a healthcare attorney. We also have Liz Hansen, Health IT Senior Specialist, Hybrid Solutions. Okay, so we're going to start off today's presentation with the poll question. Okay, so it looks like everyone has voted. So we have 71% that says once a year. Good for you, that's correct. We have 50% that says when we have an update that can impact security. And we also have 14% said when we get around to it. So we all know that you're supposed to do your assessment once a year, go over your mitigations, and that's what we have Liz and Kelly here for, to go over give you all this great detailed information on what needs to be done with your security risk assessment. Okay, so today's objectives is review of the practice security environment, overview of security risk assessment requirements, review the security risk assessment effort, discuss the security risk assessment as a resource, and tips for immediate action.
Okay, so we said we were going to talk about the environment today. So we're going to talk about this risky security climate. In March of 2021, a report was released that said there had been nearly a 40% increase in data breaches of 500 records or more within the healthcare industry. This is an increase that included business associate incidents. It included compromised emails, ransomware, network servers, all types of breaches. A 40% increase, folks. Last year, we did this presentation. We had a slide in there that said there had been a 100% increase in the last decade in healthcare breaches of information. Since then, we've had a 40% increase. That's substantial. Half of all data breaches now occur in healthcare. The FBI has warned that health data is really valuable to criminals, and that healthcare security really lags behind other sectors. But the issue is that you have to be responsible for your security. So you need to keep this in mind and take actions based on this information to keep you safe, because this ecosystem is very unsafe. And you have to remember that your data sells for up to 20 times more than credit card data. So they want your information, and you're vulnerable. Kelly, as you're working with practices, have you seen an increase or are hearing an increase of data breaches or increase in concerns?
Yeah, I get called a lot about data breaches, and it's kind of hard for me to gauge just from my clients or people that call me how frequent they are, because people call me when there's a problem, right? I don't get calls when everything's going well. So usually if someone calls me, there's been a problem. But I think sometimes when the folks do call me, they're terrified because there's been a breach. And so they're thinking, all right, we've now got a HIPAA violation. And I think one of the things I'd like everyone to remember, we're talking about this, is data breaches are a fact. It's almost inevitable that at some point your data is going to be breached. That doesn't mean it's stolen or used. That means that someone who shouldn't have access to it doesn't have authorization to use or touch your data does so. So a breach can encompass all kinds of things. The fact that there is a breach, though, doesn't mean that you yourself or your physician practice or wherever you work is in violation of HIPAA. You can do everything right and still have a breach. So, one of the things that I've been talking to people about right now is so that they know more than 50% of the supposed HIPAA violations that are reported to the Office of Civil Rights at CMS. Those are the folks that are like the HIPAA police. Over 50% of what's reported to them never goes anywhere. And like another 20% of that, what's left, actually, they just respond with education. So I think a lot of times when people see these numbers, they think, oh my goodness, we've got all these breaches. There's nothing we can do. We're going to fail. Let's not try. It's kind of like me going on a diet at the beginning of vacation. It's just not going to happen. So by the second day, why would I order the salad? I think people have that kind of attitude towards HIPAA, particularly the security risk assessment, or they think the security risk assessment is really like exercise. We all know if we walk more than 10,000 steps and eat fewer than 2,000 calories, we're likely to be healthier. But that's not what the security risk analysis is. It's not something that you could do to be healthier. The risk analysis is really like a physical, okay? It's the first step. It's to tell you where you are. And the difference between those 50% of these breaches or reported violations that actually result in some kind of enforcement and those that don't, quite frankly, are whether or not they've done the analysis, whether they've put in the work to show, wait, you're right, this happened, but we did the best we could, or at least we did something. So I think, you mentioned this at the beginning that we want to make this actionable. I would really encourage everyone here, since this is a webinar, hopefully you have a sticky note. I would just take a sticky notepad and decide that you're going to write 1 or 2 or 3 things, if you're an overachiever, on the sticky note during this seminar at the end that you're going to do, so that you can be on the right side of that equation. Because I am seeing an uptick, but I'm also seeing a lot more success on the provider side of some providers who are actually taking action up front.
Okay, so here we have some more information that we want to share. And yes, if it feels like that my intent is to scare the heck out of you, it is. Kelly can work more on the solution, but just wanted to make sure everyone understands that hundreds of HIPAA audits and thousands of breach investigations are occurring. So when Kelly is saying that only 50% of them might go on to fines and more serious concerns, that's 50% of thousands. So that's still pretty significant, and you're still included in that group. Prior to the HITECH Act, penalties ranged, up to $25,000 for a violation, an identical violation within the same year, and now that is up to 1.5 million. So the fees have included the hackers have gotten smarter. The programmers, the developers, the folks that are out there doing the black hat work, they've always been very clever. They're just having a heyday here with everybody else always distracted now with COVID and other things that are going on. So we're just kind of got a perfect storm going here. Penalties are mandatory in situations involving willful neglect. And I know Kelly's much more technical about this part, but I tell folks that in my world, if you didn't do a security risk assessment, period in a sentence, that's willful neglect, because you just heard me tell you you had to do it. Mm-hmm. Not because I told you, of course, but it is willful neglect, period, end of sentence, higher sanctions, higher concerns. And then we have the wall of shame. And so I want to take a closer look at this wall of shame, because I don't know if any of y'all have ever seen it. I assume if you were on it, you would know it. But this is a web page that is available to all of your patients for everyone to see if they only know about it. The only good thing about this site is most of your patients don't know it exists. Oh, perhaps the second good thing is that in the healthcare industry, we don't have the kind of competition where they point out that you're sitting on the wall of shame. But when you have excessive fines, then your practice information is posted on this webpage for all to see. And what I want you to look at is where the arrows are pointing. I want you to see the types of practices or organizations that are being penalized and what their infractions were. So on the left, you see that there's a pediatrician, there's a dental office, there's an oncology office. Further down, you see that it's a convalescent home. Then you see software consultants, so a vendor. Further down, you see a community health center, And at the bottom, you see Blue Cross Blue Shield of Tennessee. So you see that everyone in your industry is liable. And then the types of things may seem, well, of course, that big organization, that big insurance company had a breach. Look down the right side of the page. There were infractions around laptops and network servers, paper documents and film, network servers, email. So there are some of them for unauthorized access, some of them were for hacking incidents, some of them were loss of data. The particular loss one was for paper or film. There's all kinds of things that could land you on this wall, but even worse than that in the short run, the damage that it can do to your reputation is the cost of the fines could put you out of business. You could be fined so highly, your practice couldn't exist anymore. The risk is not worth it. Kelly, if you will, can you share with us just a little bit of what happens when one of your folks finds that they've been hacked and give you a call?
Yeah.
Can you do that with us?
Sure. So I'll be honest with you. You know, what Liz said is I am trying to help you find solutions, partly because this webinar is the cheapest advice you're going to get on this. So, you know, what I find is I have two kinds of clients. I have get me out of trouble clients and keep me out of trouble clients. And the ones that trust me to keep them out of trouble, I've usually gotten out of trouble the first time. And when they call me in trouble, they're real excited to talk to me and they're real excited to get me on the phone. And so they want to tell me their whole problem and we're going to come up with a solution and we're going to look at their cyber insurance, which we'll talk about later, and help them kind of figure out a way to pay for it. And what I find is, though, as it goes on, and we're still working to mitigate the situation 2 or 3 months down the road, whether there's a fine or not, at some point they realize that it's an expensive process to fix, no matter whether they're going to get fined or anything else. Fixing these things down the road, reporting it to patients, nobody likes that. Everyone drags their feet. If we've got more than 500 folks, we got to put it in the newspaper. Nobody likes that. Just the stress of writing at the incident report and figuring it out. So that's usually what happens. First, we're trying to find out, okay, was it really a breach? Was it a reportable breach? Was it someone who wasn't authorized? Can we prove it? What can we do to mitigate it? Because every provider has to either report it automatically or they have to show that there was a low probability that the data was touched. And that's a provider responsibility. It's not anything you can put off on anyone else. And, you know, some providers have IT folks up front to help them, some don't. And if they don't, then we've got to go find someone. It's just a lot in terms of that. But the basic steps are you have to find out the scope of the breach, find out what was taken, if it was it a reportable breach, or can we show that there's a low probability it was touched? For example, it was encrypted. We don't have to report that. And then we've got to do the actual report. We have to always tell patients what happened. And then we have to explain to them. I mean, I spend a lot of time writing really nice letters explaining how much a client cares about someone's privacy. And yet something has happened to their data. And this is what we're doing. And then actually helping folks tell it to the feds. And then knowing down the road, we're going to have to actually probably defend some sort of audit. So, and here I'll tell you, like you can see here on this wall of shame Liz has, these are a lot of emails on this one and network server hacks, right? The Office of Civil Rights knows that hacking just happens. What they want to know is, did you actually, test your firewalls and things like that? But when they come in, their response isn't show me the email. Their response is show me your last 5 years of risk analysis, all of your policies, and everything else you've done and any other incidents you've had. So you can think about that. Just pulling that together is an administrative task that takes a lot. And I think it's particularly hard on smaller practices because they almost always never have a full-time compliance person, right? They've got some person who actually runs a gazillion different really important clinical, front office things or back office things, depending on how they're set up. And then they have this on top of it, and it puts a lot of stress on the practice. So, usually we're kind of coming in and quarterbacking that defense. that's how that works.
So just to make sure that I'm clear on it, when they come in, they're typically going to ask, they're not going to necessarily address the immediate problem. They're going to ask for multiple years of security risk assessments.
Every time. So what happens is, if it's something that they really, if it's something that you really couldn't do anything about, or it's a patient complaint, if you explain that, sometimes they won't. But if it's an actual breach you've reported and they come back, and you have to understand, they're not coming back this year. We're looking at 2.5 to 3 years a lot of times before they actually respond to reported breaches. So that delay is really problematic on one hand, because you got to keep it up. On the other hand, it does give you time to prepare. But and the folks that get reported a lot of times are people who have had to report things over time. By the third, time you've reported something, you're going to have a problem. I had a client, and they actually did have a compliance officer, but unfortunately, she wasn't very helpful. So they had some issues, and we went in and we had to pull up all of their breaches that she decided weren't reportable. Well, unfortunately, I'd say 90% of them should have been reported. And so then we had to explain, okay, this is going to be awkward, but we've got to send in these reports for each of these things. And some of them were small. They were like, we mailed bills and information to the wrong patient's house, or they had at one point changed their their waiting room software, those little like speak and say looking things, you put your iPad or whatever, you put your info in. Well, they had one girl up at the front desk who just couldn't get it together. She kept giving those to the wrong patients. So they would get it and it would have all the another patient's demographic info kind of preloaded. So, that woman just needed to be reassigned. Some people you can't retrain after 2 or 3 times. But, things like that. They then, though, did have a business associate that, quite frankly, had a big breach. And my client didn't even know that this business associate still had their data. To their knowledge, they had fired them as a vendor, 4 years before, but had never actually confirmed that business associate had destroyed all their data. So suddenly business associate has a breach. It's a criminal breach. They were hacked, and they get the letter. And so now they're on the hook to tell all the patients impacted. It was definitely more than 500 about this breach they didn't involve in with data they didn't know these people still had. And in each of these things, you can totally see how it happened. And remember, this is a client that, as physician practice, that actually had someone working on this. So what do we have to do? We had to go in and actually report all of those and explain that we did it because based on a personnel change. I always like to give a story, which is true. It helped. Based on a personnel change, they were going back and reassessing, and out of abundance of caution, we're choosing to report each of these things. And by the way, here are the other steps we've put in place. And we've, of course, updated our security risk analysis appropriately.
Ouch.
Yeah. Now, ouch for them, right?
It's Kelly, but yeah, still ouch.
Ouch.
So, with that said, we asked the question, are you at risk and how do you know? I can pretty much tell you you're at risk. You may have mitigated that risk, and today it may not be an issue, but you have to stay on top of it because it can always grow to an issue. So how do you know if you're at risk? It's that wonderful resource, the security risk assessment. Now, this is also called the security risk analysis, so we don't want to get anybody messed up. It has 2 different terms that we use, and that's okay. I've heard people call it a lot worse, all right? So we're not using that term. But it is a comprehensive look at an organization's security structure. And the goal is to uncover potential threats and vulnerability within the IT ecosystem. Now, we're not talking about dust and germs on the keyboard, okay? So this takes a pretty good level of sophistication. When it comes to healthcare organization, you have to be concerned about the confidentiality, the integrity, and the availability of your electronic protected health information that is held within the organization. And there is lots of information going forward, and Kelly's going to give us a little bit more detail on this, but there is lots of information about this. The security risk assessment must be done? Slide.
So when you're looking at this, we talked a little bit about the cybercrime, and I just want to give an example and then go down through this. Because sometimes people say, well, really, why should we have any responsibility for cybercrime? So I want to explain the way cybercrime and the HIPAA work. So let's say someone comes in and hacks your system, and maybe you use an online EMR, which is pretty common right now. But someone comes in and puts software on your desktops that actually track your keystrokes, and they lock it so that you can't actually enter any passwords through your browser to actually get into your EMR. Okay. And then they send you a ransom note and they say, hey, pay us $100,000 or $50,000, depending on the kind of criminals they are. And we'll give you access to this information. Now, let me tell you the way the Office of Civil Rights looks at it. The fact that these people hijacked your information or your computers isn't the HIPAA breach. Okay. You right now have an issue where you've got a problem. Something has come up between you and your access. So accessibility of data is one of the things that comes into security. If you don't have access, then it's not secure. The issue comes if you pay the ransom because you have to. So what they want to know is that you have actually looked at that potential risk and you've come up with another way. So in other words, someone steals it and you say, well, my goodness, this is the whole reason that we have that IT company and we use a cloud-based EMR. What we're going to do is we're going to tell the cloud-based EMR to immediately wipe all of our passwords and to freeze our EMR. Then we're going to tell the IT people to come in, shut down all our computers and wipe them. And we're going to go buy 2 or 3 new computers. We're going to log into those, reset our EMR, and we're going to go in and we're going to thumb our noses at the criminals because I've come up with a different way around it. Unfortunately, sometimes what happens is this happens and people go, oh my gosh, I don't know that. Or they don't use a cloud-based EMR. They use one that's backed up, but maybe they've never really tested the backup. Okay. So that's kind of how it works. I think folks don't necessarily understand that what we're doing with all of this is really just trying to predict the future in bad scenarios. Okay. So if this happens, what will we do? And of course, we also want to know, well, all right, how likely is it? One of the things I think we've all seen is that it's become increasingly likely that stuff that we used to thought wouldn't happen. What criminal would be interested in my information? I know from my firm's IT folks, and I'm a lawyer for healthcare providers, so I have a lot of EPHI here. I'm a business associate. We have to keep secure. But people are all the time trying to get in through our internet. All the time. And we have to, as a result, each year increase our security, change how many times you have to sign in, how quickly you have to change passwords and things like that, just to keep our side safe, this back door to some of our folks' data. So I think that's important. Now, some of the things we've seen a lot of, and I think you want to make sure you're thinking about as you're doing your risk analysis, are these things like phishing. I've had at least 8 different clients over the summer with phishing problems. In other words, someone comes, it looks like a real email, they click on it, and now they have a virus. Now, I don't know most of the time what these are looking for. I don't know what's being installed, but there's clearly some sort of software being installed on their computer. Most of the time, the email is fake. Like several went out from my name one time and it said Kelly Jolley, but the email address after it wasn't my email address. But as a result of that, we had all of our folks at our firm do a quiz to see if they could tell which emails were real and which were false, and what to look for with phishing. Yeah, those are some really good, things just to do kind of a training about that because it's so prevalent. There's been a lot of fake news during COVID. We kind of joked, Liz did with that slide about HIPAA versus HIPAA. And there's all kinds of fake stuff out there with people setting up websites, knowing people are going to be Googling for information with links in them that are fake and are actually just installing spyware. So making sure that you continually update all of your web browsers and things like that are important. as we've had folks start working from home with telemedicine, a lot of people just let them go home and log in. And the idea is that, well, since they're logging into an online EMR, really our EMR is taking care of security. But if someone has spyware on your employee's computer, or they're logging in from a personal computer that their kids download stuff on, not to say anything bad about kids, but that you don't actually control, you have no idea what's actually watching their password as they enter it into that EMR login. So there's a lot of things you can do. You can say you can only use computers that, are issued. You can make sure that you have on those computers firewalls and virus protection, and that you're still automatically porting in and putting in the patches for software, because those really need to be updated. But you can also have like policies, right? Like say the no Starbucks rule. You cannot work on your EMR at a Starbucks. That's an extremely insecure place. Or you can make everyone do a VPN. And I will tell you, I see almost no one requiring VPNs at home. Right. There was a good bit of leeway given at the beginning of COVID, but that's not there. It's still going to be a breach if it happens now. I have a couple of clients who have all kinds of issues, and they've been telling me since June, well, Kelly, there was this COVID. And I'm like, that's great. But in case you haven't noticed, it's a year past when this issue first showed up. We actually don't get to use that as a getting out of jail free card for 2 years. It's just not going to work. Some things people don't think about is that, like I said, with the crime example, you have to make sure you have access to your information. So it's an accessibility, not just a security. It's not just that we can lock it down, is that we can make sure the right people can get into it and get the information. So there's that. People still use mobile devices. I'm pretty tied to mine. I've got the watch, I've got the phone, I've got the iPad. I mean, I'm the fangirl, but we have to make sure that we have security controls on whatever we're using. And at a minimum, if you're letting employees work from home, you have to make sure that they are working with encrypted Wi-Fi. That needs to be a bedrock thing. Slide. Okay, so there's a couple of things about this, and Liz mentioned this. You do have to do this. There is guidance online, and I don't know if you've ever looked this up, but everything that CMS has put out about the security risk analysis keeps talking about how it's foundational. Okay, here's something. Conducting a risk analysis is the first step in identifying and implementing safeguards that comply with and carry out the standards. So it's kind of like I said before, it's the physical. And, there's a lot of different kinds of physicals that people can get. They can get that Medicare physical that they have to do so they can see specialists. They can pay a whole bunch of money and get one of those executive physicals that test, I don't know, everything about them. You could get those and have this pretty color-coded charts. You can get those physicals that are like my husband's, which are like, okay, let's get this over with because I'm not coming back for 3 years kind of physical. Or you can just get those ones that are just kids physicals, right? Which is the one you care about. You care about your kids. So you go in there and you ask that guy 100 different things. And you say, okay, I want to know why she does this. Or what happens with this. Or she only ate green beans twice last year. What are we going to do? Things like that, right? You really get into those. Or it could be a camp physical, right? Where that's a crock. They come in, they check 6 things, and they sign off on it. And you send your kid off for a week. Those are all physicals. Well, all of those could also be a risk analysis, okay? And what you're doing as a practice for your risk analysis, the feds leave on you. They say you get to decide that. We're not gonna tell you what to do. But here's the thing: we all know that's a lie. There are certain things that they require that you do for it to actually count as a physical. Okay, so some of the things we're going to talk about here are what are the things you actually have to do, right? One of the things, if it's going to be a physical, is that folks are actually, someone's going to, at the end of it, they're going to sign off on it, right? The doctor's going to sign off on it. You have to actually have someone review who's in management and sign off on that security risk analysis. I had a client, bless their heart, they had hired a company to come in and do a really good job for them. They had someone come in and write all their policies, and they had done the stuff, and they had a whole analysis, and no one at the practice had actually ever read it. They never read the policies and signed off on them. They never reviewed the security risk assessment. They didn't actually know they had one until they sent me a folder with stuff in it. Okay. Let me tell you, none of that money went to anything, and none of that happened because it wasn't signed off on, having it approved at the end of the other things I've seen. I had other clients who insisted, no, Kelly, we don't need you to see our security risk analysis. We've been doing it every year. Okay. Well, finally I said, just humor me and send it to me. And it turned out it was a 2-page Word document that was like a summary of what they did, who they hired for different positions, and what their software was, and where the policies. And I was like, well, dang, I wish I had required it a couple of years ago, right? They really meant well, and they did have something, but a summary is not an analysis. And the way we know this is that even though CMS says, no, y'all decide, you have to do this, but we're not going to really tell you how to do it. They put out guidance that throughout says, you don't have to follow the National Institute of Standards and Technology unless you're a federal agency. However, this is a quote, the guidelines from NIST represent the industry standard for good business practices with respect to standards for securing EPHI. And then they go on down there and they say that if you're not following these standards, you need to be able to explain while you're following what you're following. Well, that's not very nice, right? That's like saying you should eat, 5 vegetables a day, but you don't have to. If you choose not to, be prepared to explain to me why you didn't and what your health scheme is with data. And that's really what they're doing. So, first off, when we say this, I just want folks to understand it's not like it is the law, but it's something that you really have to put thought into, because I think I've been telling people for so long, this is the law, you've got to do this. They have it in their mind that it's something we can do and check off. And it's really not. It's a thought process. Now, you also have to do it because of MIPS and other stuff. And, I would say, I understand about MIPS. I know there's money involved, and that's great. But here's the thing. Ask yourself this question. Do you file electronic claims for any service? It could just be one. If you file electronic claims for anything, then you're a covered entity under HIPAA. And you then have to do it at least annually, but really anytime it needs to be done. And here's the thing. I think it's good. Actually, the security rule, we talked about this, Liz and I, before. It doesn't say how many times you have to do it. But again, what it does say is you have to do it as needed. And if you don't need to do it annually, you need to explain why. And the only way you can explain why you don't need to do it is by going through and saying what hasn't changed. And y'all, you might as well just read through it and then sign off on it and say, nothing changed. We agree this is still the same thing. So you're really doing it. Slide.
Right. That was one of the things that we had talked about, Kelly, is okay, if you read that law, it doesn't technically say you've got to absolutely do A to Z every year. But by you're going to be responsible for having done it. So just do it. Sorry.
And this quote here, what we're really just saying is you just need to make sure that what you're doing in your practice is protecting your data, and you're protecting its confidentiality, meaning people that shouldn't look at it aren't looking at it, its integrity, its wholeness, that someone can't come in and mess with it or pull out part of it, and then the availability, that it's available. And like I was talking about the NIST stuff, they actually use the NIST definitions for things like threats and vulnerabilities and all of those kind of things. So if you aren't sure what those are, looking up for those free examples is always a good thing. Slide. And I'm looking at the time here, so I'm going to go through this. Okay, so this is actually what comes out. This is an example of the different things you're supposed to be doing. You can see here, and this is available online, you've got your standards. This security management process is what we're talking about. And what's the number one thing in that process on the left is the risk analysis. That's why it's foundational. And that means you can't actually be secure if you do not have a current risk analysis. It's just not possible. And that's why they always ask for it, because they, it's easy for them to find out how you messed up if you didn't. What you want to make sure is that you have considered each of these different areas. And like I said before, that poor client, the summary isn't an analysis. The examples of things you're supposed to be thinking about is, okay, where is your EPHI? Anything you create, maintain, receive, or transmit that you are responsible for, where does it come from? They're looking to see that you actually considered those questions. And if it's just a summary, you're not going to be able to do that. That's why spreadsheets and things like that are so popular. Slide.
Okay, so now we're going to just chat a little bit about the SRA effort. And we've actually been talking about it all along, but we just want to make it a little bit more pointed. And because of time, and we want to get through these questions, we'll kind of go through these a little quickly. The risk analysis has to identify how EPHI is created, received, maintained, and transmitted, as Kelly just told you, especially including your electronic health records. And for those of you who are also now participating more fully in health information exchange, then that transmission piece, and you're being more active with your patients and putting information on the portal and sending information through direct, that transmission has increased or should be increasing rapidly over the next few years. You have to identify potential threats and vulnerabilities to this protected health information. This could be cyber attacks, theft, somebody could steal the computers, could be a workforce member error, natural threats, fires, tornadoes, any environmental threats such as pollution or power loss. You have to consider all these things on top of everything else you do. But there it is. You have to consider it. You have to identify the risk, and then you have to assign a level of risk to them, high, medium, or low. Going to talk about that in just a second. So what you have to do is consider what's the likelihood of this occurring, and then what is the cost to our organization, soft cost and hard cost, if this occurred. And then that tells you if it's a high price tag, that's a high risk, okay? If it's incredibly likely to happen, then the risk is higher. So you have to put these pieces together. You don't have to go back to school and get a stat course refresher, but you have to use a little bit of science on this. Slide. So the scope of the data, you have to look everywhere the data is. Okay, you can't just count on your IT company. And I know this isn't the presentation where we tell you, please don't trust your IT company, just do this by themselves and stay on top of it. But that's what you have to do. You can't just do what they do. You have to consider everything. And the IT company doesn't necessarily know what's going on with you and where all your data comes from and where it goes. You have to assess and implement. You have to be reasonable and appropriate. You have to ensure the confidentiality, the integrity, and the availability. And you have to cover creation, receiving, maintenance, and transmission. Slide. Slide, yeah. Okay, so some of you had asked in the questions for some basic steps of what you needed to do. And although we have talked in the past, and if you want to call us from assistance, we have some tools that you can use. Of course, there are some tools you can use yourself. We always recommend get a professional to do this if you can afford to. And my usual question is, can you afford not to? But that's beside the point. We've got some tools to help you. You just have to do it, and you have to do it right. You have to understand your scope. You have to do an inventory of all your systems, including your copiers. If they've got EPHI on them, they have to be on your inventory list. You have to go through the current security measures, update your policies and procedures, go back over past security risk assessments, and make sure everything has been mitigated and is up to date. Identifies your risk. Consider what you think is a concern. Ask your coworkers, your managers, use all the tools you have and all the staff you can. Determine the likelihood of threat and potential impact, and give it a dollar figure. Document your findings. If it's not documented, it didn't happen. Create the risk assessment report, mitigation report, and present that report within the practice. Okay. Don't just don't just do all this work and not use it. Use this to make your practice secure, and then make a mitigation plan and implement it. And don't make it to be completed within the next 12 months. Okay. That wouldn't work too good. Of course, you're bound to get it done before they come in and check on you, but the trail will show it. So we have to make sure that we follow these steps. And of course, within each of these are a lot of nuances. Slide.
So here's the thing, you have to think program, not project. And we were talking, with the quiz, like how often you have to do this. What it says in the guidance from CMS is that the risk analysis process should be ongoing. So if you do get audited, I always suggest people say something like, how often do you get risk analysis? And you say, well, we're always analyzing our risk. It's a constant thing with us. However, we confirm that we've reviewed our written report at least annually or whenever we make a change, because that is pretty much the right answer. But remember, it is something you got to be doing all the time. It's not, I do though I like to calendar it. I calendar everything. So I usually make January risk analysis month for most of my clients. And we just plan on making sure it's done then. Slide. So like I said, it's an ongoing activity. You don't have to do the full thing, but you do need to review it all and make sure that none of your answers to the questions you're asking yourself have changed. And then you have to at least update it. It's like I said, documentation, let's just say this is key. If it's not written down, it doesn't count. They just don't count it. And when you are attesting that you have it, you are actually saying, we have this written down. And it contains all of the elements. And you can, anytime you tell the Fed something that's not true, it's a problem. So remember that when you're attesting, this is something you're saying you've done. And at a minimum, open your spreadsheet or whatever you're doing it in, review it, and then save it as a PDF and put a new date on it to show that you've done it. You can do it all electronically, but it is important that it has a new date and that you didn't overwrite the old one. That's the worst, when you think you've got some things and they're gone. Under, providers have to review risk for each EHR reporting period. So that is a hard and fast reporting period, right, Liz? That's
yes,
each year. And then anytime you change stuff, examples of things that change. If you have a key personnel change, like that compliance officer that left, if you change IT companies, if you change EMRs, if your EMR does a big change, like a big platform change or anything like that, that's different. If you hire a different lab vendor or someone else who's getting access to your EMR, all of those are times you should be saying, okay, the fact that we've hired this other vendor or doing this different, will that actually impact the answers to the questions we had before? And what would the risk be? Is there a change to risk? Those are the special circumstances you've always got to be thinking about. Slide.
And Kelly, I wanted to mention that in the next year, folks will be upgrading to the 21st, to the CARES 2015 certification EHR. They're participating in the MIPS program. And so that would be a major upgrade to your EHR. Yeah. So if you've already done your security risk assessment this year, you need to update it when you get that 2015 CARES certification upgrade to your system. I don't think I've seen any yet. But I think they have to be in by 2022. So I'm hoping those are going to start pretty soon. So we want to make sure we get those upgrades done after that.
Okay.
Let's see. Is this one yours or mine? This one's yours.
Yeah. So some of the things that I see when I'm looking at these is folks don't quantify the impact. In other words, they say there's a risk. And what would the risk to us be? Our practice be if this happened? And they say bad or really bad. And that's not really what they're looking for. They're looking for, okay, have you really thought about it in terms of money? In other words, step over the bodies, follow the money. What's the result going to be to the bottom line? And this is really hard, I know, for practice managers to figure out. But this is where sometimes I can get physicians to pay attention, because I say, well, let's figure out the dollar amount, because that's the dollar amount coming out of your pocket if this happens. And that might give us a better, rule of thumb about what we might be willing to pay to make sure we avoid paying anything out. They don't address all three aspects. In other words, they're only looking at security in terms of other people can't get into it. They're not thinking, well, what if we had a ransomware attack or we couldn't access it this way? Could we get there? Or they might not be thinking about threats. What if we can't get into our office? How secure is our information? Could we get it from somewhere else? And that's a big thing, especially in the South where we have hurricanes and stuff. Not looking beyond your internal systems. So in that sheet I showed you, that was just the overview of the requirements. There are both technical and non-technical safeguards that you're required to meet. And Liz mentioned this, why you can't just look at your IT company. Non-technical safeguards are things like policies, and those are supposed to be reviewed every year. Almost never do IT companies actually ask you for a copy of your policies, and they do not review them to make sure they're adequate. That's just not what they do. You can't do a good security risk analysis, in my opinion, without IT,
Right.
but IT can't do it alone. So they're necessary, but not sufficient to do a security risk analysis. And if so far you have been doing your IT without an IT company, I would strongly encourage you that today's environment is so risky that is almost asking for trouble. That's not, CMS hasn't quite said that yet, but that's where they're headed. Not testing. If you have backups and they've never been tested, the Office of Civil Rights is taking the position that that is an insufficient backup. If you can't say, yes, we tested it and it works, that's a problem. And I get a lot of pushback from IT companies. Well, we know it works. Well, I need you to show me. So if you say it works, just sign off and say you tested it so that my clients can depend on your certification. And if it doesn't work, then we're going to go back and ask you about that. Not having a mitigation plan. In other words, we've come up with a list of issues. And if we haven't actually come up with a plan with dates of how we're going to resolve those issues, then we haven't finished the analysis. And I know that's a big part, Liz, you've said before with MIPS, right?
Yeah, when they do the audit for the Medicaid incentive program, and we anticipate this will also be true for MIPS, more people failed the meaningful use audit program because of the incomplete, no mitigation plan than anything else. So they're pretty serious about it. You need a mitigation plan that's dated.
And if you're going to have a mitigation plan, you should actually make some progress. You do not have to hit them all, but several times if you go, I like to go back in and read, the stories of the poor pilgrims that got popped and see what they are. And very frequently they will say, this issue was noted in their security risk analysis 3 years before and nothing had changed. And they always take that as evidence that they need to find these people because otherwise they will not take the responsibility seriously.
So some other common security mistakes that we see is the improper handling of business associates. I continue to have practices ask me if they really have to mess with the business associate agreement. And Kelly, you might want to add to this, but boy, if you don't have those signed, their vulnerabilities are your vulnerabilities. You've just bought somebody else's problems, or you're just owning someone else's problems as well. So you need to make sure you get those done. I think, Kelly, we've talked in the past, you don't actually have to get those redone every year, but you need to make sure they're current.
You have to review them as part of your analysis each year to make sure they exist.
Right.
Yeah.
And most of my folks find that they don't exist. So that's okay. That can be resolved. After the fact, it's a little too late. Poor data security, not encrypting your data at rest, or improper and inappropriate transmission. I know we had someone ask us, how do you securely send email? Well, my goodness, there are several options for securely sending email, and none of them are just using Outlook and sending over an email. Okay, that you can buy secure email packages, software packages that are encrypted. You can use a direct email, which is a secure messaging system for the clinical environment. You can use the patient portal to send messages, which should be secure. So there are a variety of options, but just sending emails out is not acceptable with patient information. Poorly implemented access controls. Most of the folks I work with don't require the types of logins and passwords that they should. and they don't make the system go blank after 3 minutes, and they don't make people reset their passwords after 90 days. All of that makes them vulnerable. All of that, in my opinion, and there's others that are levying the fines, that's willful neglect. If you know what you should be doing and you're not doing it, that's going to be a higher fine. So take that into consideration when you're gauging what your risk is and what the costs are. You have to make sure there's backup procedures. Most folks are so much better with backup procedures than they used to be. But I think because over the 20 years, everybody's lost some data at some point. The same is true for your recovery plan. And then make sure that you close the loop. Make sure you're doing the things that you said you're supposed to be doing. Because as Kelly has reminded me very many times, to say that you ought to do something is not going to fly if they come to your house and take a look at what you're doing. And failing to sanction when folks have broken rules. I got to tell you that probably 80% of my practices don't even have sanctions or are not implementing them at all, because good people are hard to find. But it's not worth the risk. Next slide. So we are running up on our time frame here. Kelly, Selena, do you want us to go ahead and finish this, or do we want to take some questions, or we only have 2 minutes?
Let's take questions. I think we've kind of hit a lot of these things. So I think folks understand what they've got to do. I'd love if we could answer some targeted stuff if we have some.
Would that be okay, Brianna? Do we have some questions that we could speak to?
Absolutely. We do have some questions here. So I have one question that states, do you have to complete a security risk assessment if you are not part of an APM?
If you were filing, if you're getting paid through electronic claims, you do have to do a security risk analysis. Absolutely.
So if this person is asking about an APM, that's an advanced payment model for the MIPS program, very specific to Medicare coverage. But being a member, and you would probably be in an ACO, and you're probably in Georgia, you're probably participating in the Medicare Shared Savings program, because we don't have many other programs like that available. The answer is you got to do the risk assessment. Doesn't matter whether you're in ACO, not in an ACO, whether you're an advanced APM or just an APM. It doesn't matter whether you even know what those acronyms mean. You have to do a security risk assessment. Good question. Thank you.
Great question. All right, I have another question here. Well, not really a question, more of a statement / question. So it states, I did one of these about 2 years ago. Is it still valid? I
don't know. I don't know what's happened in your shop in those 2 years. So it's not for, we can't tell, and you probably can't tell unless you take it out and you go through and look at the answers to the questions you gave and decide if any of those answers have changed. And then also, of course, looking at the end to see, okay, what did you identify as risky with a high impact, and did you fix those things? And then go into the next stage. So the answer is it might be, but the only way you can prove you can rely on it is by going back through it at least annually.
That's great. All righty. So I actually have another question that just popped up through the chat pane, and it states two questions. Okay. Did you answer that, Selena?
Yes, I did.
Okay. So I'll go back to my other pane where there's questions as well. Are there any new requirements for 2021?
There aren't. What happens is that there aren't really any changes. There are a few things in terms of what might have been different if you were doing COVID testing. There were some safe harbors for that, but those really don't change any security risk analysis requirements. CMS is supposed to put out annual guidance on the security rule, and I find they do not.
Yeah.
So if you Google, security risk analysis and go look at their website, you're going to find things from 2010 still posted up there. There's more up-to-date stuff on NIST and examples of that, but there's nothing that's really new in terms of what you have to do. You just have to keep doing the right things.
Yeah.
Okay, so another question just came through the chat as well. It says, how often do we need the Business Associates Agreement updated? Are the ones from my last SRA in 2017 still valid?
Okay. So you have to have a business associate agreement signed with every vendor that has regular and routine access to PHI. And that's whether it's electronic or paper. Okay. It doesn't mean that they have to be touching it or even looking at it. For example, your internet provider most likely is not ever seeing your protected health information, but they are by statute considered a business associate, and you need to have some sort of business associate agreement with them. So if you have a current business associate agreement, then that's going to be fine. Generally, if they were signed in 2017 and you still have a relationship with that vendor, then that one's going to be fine. The only way, though, for you to really know that is for you to actually inventory every place you have data, all your business associates, anyone with whom you have a contract where they could have regular and routine access to your data. And then that you have a current business associate and that you've inventoried those and made sure they're signed. If you do not have a signed copy, then you need to go ahead and ask them for a copy, and both parties need to sign it for it to be valid, y'all. If you don't, then you need to go ahead and send them another one and say it's part of your annual update. What I find is people will do them and then they don't really pay attention to who's no longer a vendor.
Right.
They don't go back and ask them to return the data or confirm it's deleted, or they don't go get a new one. Now, there are some proposed changes to HIPAA that they've taken comments on through the summer, and we're now waiting to find out what comes out as a final rule. And they do have some implication for physicians, but the comments there's a lot of comments back and forth on them. So once those come out, I suspect that all business associate agreements may need to be updated. As if those changes come out, I wouldn't expect us to see them for at least 6 months. But if so, then you might need to do it. But right now, it should be fine. But again, you're going to have to go through and assess whether the contract is current or not.
Thanks so much, Kelly. Okay, so we are running kind of over on time, so we're going to kind of close it on the questions. This webinar will be available within 7 business days on our site, so please be checking in on the Highbridge website for this presentation should you want to rewatch it. Hybrid Solutions has an amazing partnership with Format Approved that provides our members with discounted training, continuing education, and professional development opportunities. Training is approved for nurses, clinicians, providers, consultants, etc. It's a really awesome resource, and it is accredited and self-paced. Please use the coupon HIBRIDGE20 to receive a 20% discount. Again, the coupon code is HIBRIDGE20 to receive a 20% discount. The website is www.formedtrainingcenter.com/hybrid solutions. Again, that's www.formedtrainingcenter.com/hybrid solutions. Slide. And here are some resources available to you all. We'll just give it a quick minute.
Is this posted anywhere where someone could actually get it and click a link? I don't know.
I think when she posted on the website, then those can be accessed. Is that correct, Brianna, Selena?
Well, I don't think they can actually click when it's posted when the webinar is published on YouTube, but our contact information is at the end of this presentation, and we can get you a copy of the slides with the links. So if anyone that's interested, we can make this available to you, and that way you can just click directly on the links.
Excellent. Excellent.
Thank you so much, Liz and Kelly, for that wealth of information, and thank you all for joining. Everyone have a great day.